Hi, everyone. Thanks so much for joining me on our topic of Healthy Heart, Healthy Brain series. Today, we're going to focus on continuing with our heart disease and women focus. And I want you guys to think about what are the 10 heart attack warning signs in women. That's what we're going to talk about today. As you guys, many of you know, I spent the majority of my 25-year healthcare career in cardiology. So this is definitely near and dear to my heart, no pun intended. And this comes from the book Healthy Heart, Healthy Brain by Drs. Bradley Bale and Dr. Amy Doneen. And we'll share that information at the end of this presentation for you if you're interested in the book. My name is Linnea Baker, and I am a board certified family nurse practitioner. I'm so grateful for you for coming on and listening and getting some information that could truly save yours or a loved one's life. And I'm grateful that you're giving me some of your valuable time. So a little bit of background, women's symptoms of a heart attack are often different than men. And because of that, many women don't seek medical care right away. And when they do, they're misdiagnosed, okay? And I think there's several reasons for this. Honestly, women in general, we're caregivers. We're worried about our family, our spouse or partner, our career or work or job, taking care of the household, and we're constantly taking care of others and putting ourselves at the bottom of the list in many cases. And that's even if we put ourselves on the list at all. So we tend to band-aid our symptoms and just ignore things and not get in and get things taken care of or looked at. And I think that's part of why we just don't get seen right away and also we don't think it's as serious. We figure we're fine and we don't think things are as serious as they are. So when we know better, we can do better. We can't pour from an empty cup. So a lot of what I talk about, and you guys know this, is self-care and things we can do to live a longer, healthier life and also to fill our cups up so we have more to pour into the ones we love most. So this is so important for us because when we know better, guys, we can do better. Women's symptoms tend to be more subtle and they might not even involve the chest. And I think that's what makes it so tricky is people associate a heart attack with holding the chest and chest pain. And in women, it may not even involve the chest at all, and they could still be having a heart attack. That's what's concerning and why I'm doing this. Women in general, especially younger women, don't believe they're at risk of a heart attack. And we talked about this in prior presentations. So go back in this series and look, but we talked about how heart disease is the #1 killer in both men and women, and that it's happening in even younger people. We used to think it was a disease of elderly or older people, but that's not the case anymore. Men and women in the 35 to 54-year-old group are definitely having more and more heart disease. We've talked about that related to the health of the country in the United States and inflammation and all the things. So there's more heart disease in younger people, both men and women. A lot of women think, unfortunately, this is not true, but many women think that they're protected until after menopause because of estrogen, and that's not true. Women are having heart attacks at younger ages and before menopause. So we do need to be aware of that. And because women think they're not at risk, they delay seeking out medical care. And that's where we can get into a lot of trouble and do permanent damage and have life-threatening disease. I mean, heart disease is the #1 killer in both men and women. And if we delay getting medical care, we could have serious, unfortunate consequences where we don't survive it, okay? And that's why it's so important to be aware and share this with people, with men and women, so that we can look out for each other, share information with each other, and make sure that we're paying attention to things that our body is telling us and we're taking care of it and getting the care we need. These symptoms can also occur in men, so it is important for both genders to know all the warning signs, although it's more so in women. Men will typically have the elephant on the chest, but they can have other symptoms as well. And I've taken care of plenty of men who have. So please make sure you're sharing this with both men and women, because the more we're aware, the more we can take care of each other and help each other. So 10 symptoms of heart attack. The lady there that's holding her chest, kind of that elephant on the chest feeling, that's what most people think of when they think of a heart attack. Yes, I've seen people have that happen, especially more so in men, but that is not the typical symptom in women. And so we're going to go through some of the other symptoms that we need to be aware of, because women may not even have chest pain, like we said. So when we talk about pain in the upper body areas, it could be jaw pain, neck pain, back pain, shoulder or arm pain. Now, here's the kicker. It's not always left arm pain. I know a lot of people think left arm pain or numbness is a heart attack only and not the right, but it can happen on the right side too. You can get right arm pain, tingling or numbness in your hand or down your arm. So that is definitely something you need to be aware of, that you could be having a heart attack. Definitely, I've had plenty of patients with jaw pain on either side of the jaw, into the neck, in the upper back, between the shoulder blades even, okay? I've had lots of patients who've come in with heart disease, going into and having a heart attack, that had all those kinds of symptoms. So be aware of that. With the chest, you can have fullness, squeezing, or pressure on the chest. It doesn't always have to feel like an elephant sitting on your chest. It can just be a full feeling or squeezing sensation. There's so many different things, so be aware of that. You may also have a choking sensation that feels like heartburn or indigestion. It may even be in the upper abdomen and not necessarily in the chest, or it could be in the chest. So being aware of that. Dizziness or feeling lightheaded are actually symptoms of a heart attack. They can be, okay? Nausea with or without vomiting can be a symptom of a heart attack, as can shortness of breath. So being very aware of these things and knowing what to look for and not blowing it off, and knowing to call 911 and get medical care if you think you're having a heart attack. So abnormally heavy sweating, we call this diaphoresis, or actually having that cold sweat breakout that you may feel is stress related. That's all can be symptoms of actually a heart attack. Unusual fatigue, feeling unusually tired, extreme weakness or anxiety, or even having a sense of impending doom are all symptoms of a heart attack. They can be. Having a rapid, irregular pounding or fluttering heartbeat, having sudden confusion, and also abdominal pain that may feel like indigestion or severe abdominal pressure that may feel like an elephant sitting on your stomach. Okay, so abdominal pain, indigestion, that heaviness, fullness, feeling like there's an elephant on your stomach, those are all included in these 10 symptoms of a heart attack in women. They can totally be that you're having a heart attack and not having indigestion. And it's more important we make sure you're not having a heart attack, right? So how do you advocate for yourself? Well, if you're suspicious that you're having a heart attack at all, you immediately call 911. And that's because every second counts. So the longer you wait, if you're actually having a heart attack, you can damage your heart muscle. One, it's life-threatening. We know that heart disease is the #1 killer in men and women in the United States. So one, we want to make sure you get life-saving treatment immediately and that you survive a heart attack. Two, we want to make sure that we can recover some of the heart muscle, because if you're having a heart attack, the faster you get medical care, the sooner that you get treatment for it, the better your chances of recovering more of the heart muscle, okay? Because once it's gone, it's gone. And there's all kinds of biochemical and science type information to explain this to you. You don't need to worry about that, and I don't want to bore you. Just know that every second counts, call 911, because also, when you call the 911, if you think you're having a heart attack or suspicious you're having a heart attack, they can start treatment en route to the hospital, which can also save your life and help prevent further damage of your heart muscle. So that's very important as well. And typically, or usually, when you come into the hospital, into the ER on an ambulance, you'll get faster care usually, okay? And that's very important if you think you're having a heart attack. Now, you also want to tell medical providers that you think you're having a heart attack. Actually say the words. Don't wait for them to tell you. Tell them, I think I'm having a heart attack. Don't let medical providers brush you off. There's lots of amazing medical providers out there, but it is also, you need to advocate for yourself. I've been in healthcare a long time. Just, I think I'm having a heart attack. You can tell them that when you see the medical provider and when the ambulance comes. Don't let them just brush it off as anxiety, heartburn, or some other non-heart or non-cardiac cause. Because heart disease, a heart attack, we want to rule out the worst case scenario before we start working on, oh, it's indigestion, take some Tums. We need to rule out that it's not a heart attack first, because that's the most serious thing. And that's what could kill you, to be honest. Okay. Now, when you do say that and they say, fine, we're going to do an EKG. Well, don't let them stop with an EKG, because an EKG, an electrocardiogram, can be actually normal or inconclusive, especially in women. So what do you want to ask for? You want to have cardiac enzymes measured. It's a simple blood test, guys. And what you're looking for is a high sensitivity troponin test, a blood test called a cardiac enzyme measurement. It's high sensitivity troponin. And what that does is it checks for elevated proteins that are released from the damaged heart muscle cells when you have a heart attack. So that's how they know if you're actually having a heart attack or not. That's the test you want to ask for. Something else I wanted to add, if you're diabetic, men or women, diabetics typically don't have normal chest pain symptoms either. And that's because the nerve endings change when you're diabetic. So just like you can get the paresthesias, the numbness and tingling in the feet, it can affect your eyes, your kidneys. Well, diabetes is a big one for heart disease. And typically with my diabetic patients that came in with heart disease, because the nerve endings change now, it's possible you would have chest pain or something along that lines. But most of my diabetic patients, it was more feeling more and more tired, real subtle signs, feeling more winded or short of breath, things that didn't happen necessarily right away. So just be aware that if you're diabetic, you really want to be in tune to your body anyway, no matter what, whether you're diabetic or not. But if something doesn't feel right, it's important to jump on that and get checked, because it actually could be something serious like heart disease. And of course, diabetes has a lot of serious, unfortunate outcomes. And so you do want to be in tune to your body no matter what. But for sure, keep in mind that diabetics may have a little bit less of that awareness that you're having a heart attack, because it's so subtle sometimes, okay, depending. Like I said, it can go anywhere from just having, not just, but feeling like you're just more and more tired, you're kind of short of breath, it's kind of slowly getting worse, versus a sudden onset of chest pain. So there, it runs the gamut, guys. There's so many different things that people have presented at, and just make sure you're advocating for yourself that you think you're having a heart attack, and ask them to do the highly sensitive troponin test. And don't feel like it's like you're bothering anyone. Don't feel like it's, they'll tell you, the medical provider tell you, really, it's okay. You should communicate with the healthcare provider. You should ask for what you want. You should tell them what you think is going on, because that's going to help you get the care you need. Okay. And the medical provider will then have that on their radar for you. Now, I did put this up there. This was from the American Heart Association. So I wanted you to see this diagram of just this picture, because I'm a very visual person. And the American Heart Association puts up these heart attack symptoms, men versus women, most common heart attack symptoms for both men and women. Well, they say the most common for both men and women is chest pain. Obviously, chest pain across the board, we're going to think heart attack, but women may experience less obvious warning signs. And they go through the list on here. So I think this is a great visual on top of those 10 symptoms that could be a heart attack that we just talked about. Okay. So let's talk about our action steps, or our call to action. The longer a heart attack goes untreated, the more damage is done. So it's so important that we act fast, we call 911, we get in, we get seen. Let them do the troponin, highly sensitive troponin blood test, and make sure it's not a heart attack. And then if it's not that great, they can go through the other things that it might be. But let's make sure we're ruling out heart attack first, and we're not ignoring these symptoms that can be more varied and vague than what men usually present at. Okay, so hopefully this was helpful for you and brought you some value. I would love for you to invite 5 women to this health and wellness group, to, or if you're watching this on my YouTube channel, invite them to subscribe to my YouTube channel, because I really want people to be educated in this and to just start thinking a little bit more. If we talk about it, if you listen to this presentation, it's going to help bring things to the conscious, where if you're having symptoms, you're going to start thinking of other things like this could be a heart attack versus ignoring it and thinking it's unrelated. So invite 5 women to this group who you think need to hear this, and tag these women in the comments of this video. So you can just put @ and their name and tag 5 names in the comments section so they can hear about the 10 warning signs of a heart attack in women, so they can be educated and aware, and then they can share it with more people. And over time, this is how we educate and get people who can advocate for themselves, and especially in women, because a lot of times we're having worse outcomes because we're not getting seen fast enough. So I want women to know to get in and get seen, call 911 and get seen. 2, we're ignoring the symptoms, or when we finally get in, the doctors aren't thinking, or the healthcare providers aren't thinking that we're having a heart attack. So just stating we may be having a heart attack and knowing you want a blood test called a highly sensitive troponin to rule that out. This can really save somebody's life. If this were to save one life, it's worth it, guys. So share this with family and friends, invite them to this group, and tag them in this video so that we can spread this awareness and education and advocate for ourselves and start living longer, healthier lives. Okay, guys? I am on a mission to positively impact your health and wellness through education and coaching to create generational health and a health span that equals your lifespan. I'm so passionate about this. That's why I do this education, and love getting to share knowledge and show you the resources of where I got it so you can continue to educate yourselves. And obviously, you want to talk with your personal healthcare provider who knows you best. And please feel free to reach out to me if you would like to have a free health and wellness consult, or if you have questions. I'm not your personal healthcare provider, but I can walk through a holistic, healthy lifestyle approach with you. And I definitely want to make sure that you're reaching out to your healthcare providers if you're thinking you're having any questions or concerns. So you can reach out to me by commenting below or private messaging me, and you can start having more and more discussions and knowing when to seek emergency medical care and call 911 if something is happening that makes you think you're having a heart attack. Okay. This is the book, Healthy Heart, Healthy Brain. This is a fantastic book. I don't have anything to do with the book. I just found it through some research I was doing and got it on Amazon. It is written in layman's terms, which means you do not have to be medical to read this book and understand and get something out of it. It is absolutely written to be funny, and not funny in a way that belittles or demeans the seriousness of this disease, but actually in a way that makes it so that you can remember things, and keeps the reading a little bit light. Because it is a heavy topic to talk about. So I encourage you, I'm only taking snippets from this. I highly recommend you get this book and read it for yourselves, give it to your loved ones. It's so important to be educated on this. I just had a very dear friend have a sudden cardiac death event from a heart attack while driving. Thank God he survived. And because his friend was with him, he was able to start CPR, and he was able to get an AED quickly, and he got to the hospital and survived the heart attack because that people were aware and jumped into action. Thank God there was no serious injury for anyone else in the car accident. And then he went through quadruple bypass surgery and also a defibrillator implant. So this is near and dear to my heart, guys, for real. This is stuff that happens to people I love and know. And I want you guys to be aware of it, because I don't ever want that to happen to anyone. It breaks my heart, seriously, to see everyone I used to take care of in cardiology, to see family and friends suffering from heart disease and heart attacks. My dear friend, it's like he got a second lease on life. It was truly guardian angels that kept him safe that day and brought him back. So because of that, And because of my background, I just want you guys to understand that this is important. It is the #1 killer in the United States in both men and women. It's happening at a younger age. So let's share this so we can make more people aware and try to educate more people so that maybe there's something that they will recognize that maybe they wouldn't before that can get them the life-saving treatment sooner that they need and give them better outcomes. Okay, guys. Thank you. I'm so grateful for you for showing up and listening today. And I look forward to talking with you again in about a week in the Healthy Heart, Healthy Brain series. We'll be continuing on women's heart health and heart disease. And until then, be safe. Bye, guys.